Well, 3D mammogram options have changed the game when it comes to diagnosing breast cancer. That's available at Liberty Hospital Women's Imaging, where Dr. Amy Patel is the medical director. So first, let's talk about what are 3D mammograms?
So 3D mammography is just this incredibly transformative technology in the detection of breast cancer. So what is happening now is that we have this incredible tool to detect breast cancer that is a bit different from the conventional 2D mammography. So what happens is that when we obtain images of a patient's breast, we have what is an X-ray tube that's moving at multiple angles so that it's able to take multiple projections of the breast so that we are able to view the breast at the workstation, sort of like a CAT scan where we're scrolling through the breast tissue at millimetric slices. So if there is a cancer that's hiding within the breast, particularly in those women who have denser breast tissue, we're more likely to see it than the conventional 2D mammography where we just image or viewed the images with just static 2D imaging.
Okay, and your own opinion, why is this so much better than a 2D, 3D versus 2D?
So it is so much better because of the way we view the breast. So like I said, since the X-ray tube is moving, particularly in different angles, so we're able to look at the breast tissue at different slices, and you can't do that with 2D mammography. And as a result, what we're seeing, particularly in the literature, is an increase in cancer detection rate. And so, you know, at least by the literature is still sort of sifting itself out, but we're seeing around 2 cancers or so additionally found with 3D mammography per 1,000 mammograms. So it's really important.
That makes a huge difference for people.
Huge difference.
You're that one who gets caught.
Exactly. For me, every patient matters, and so to even detect one additional cancer, I think is incredible. So the benefits are really proving to be superior for women. And because of this as well, we're able to detect cancers early. So we are much likely to detect a smaller cancer earlier. And we know that when we detect cancers earlier, that it leads to less invasive treatment for women, and they're able to live a longer life than catching it perhaps later, and then they may not have as great of an outcome.
Okay, Dr. Amy, I'm going to brag on you for a second because you actually helped pass a bill with Missouri lawmakers that makes it more affordable for women who want to get 3D mammography who maybe couldn't otherwise. Tell me about that.
Yes, so really it was a team effort. So Representative Dean Plocher in Missouri actually introduced this bill, and it was just an amendment of the previous existing bill, and in concert with the Missouri Radiological Society and the Missouri State Medical Association. So previously the legislation, basically in the legislation showed that only private insurers were required to cover the cost of 2D mammography every other year starting at age 50. Now with this new bill that comes into effect in January, private insurers in the state of Missouri will not only be required to cover annual screening mammography at age 40 for 2D mammography, but also for 3D mammography. So that's really incredible because we know that 1 in 6 breast cancers are found in women from age 40 to 49. And also because of this, which this does take effect in January 2019, the Kansas Insurance Department soon after declared that starting in January 2019 that private insurers in Kansas will be required to cover annual screening 3D mammography. So Missouri and Kansas are now the 15th and 16th states in the United States that are taking a stand and saying that insurers need to be covering the cost of 3D mammograms for the screening exam.
Well, Dr. Amy, thank you so much. We love it when both our doctors and lawmakers are working together, so thank you so much. If you would like more information, go ahead and call 816-792-7089 or visit libertyhospital.org.